That's exactly what happened to Vernell, to Johnny, and to Venus. These women were denied insurance, and now Johnny and Venus are each paying very high premiums for their coverage. And as you've heard, Venus's insurance won't even cover treatment if she has a reoccurrence.
Venus Ginnis is here today from Texas. Venus discovered that she had a lump in her breast in 1992. She lost her health care coverage when her employer was sold to another company, and since that time, she has struggled to obtain affordable health care. While she battled this disease, she founded a nonprofit organization called Latina Health and Wellness to provide free health education and screening services to those who could not otherwise afford them. So Venus, do you want to come up and tell your story? Thank you.
Muy buenos días. It is truly an honor and a privilege to be here to tell you my story. Thank you, First Lady Obama and Dr. Biden, for your gracious invitation. As a Latina breast cancer survivor and advocate, I made it my mission to provide Latinas with culturally specific health education to increase screening and reduce mortality for breast and cervical cancer, not only in the United States, but globally. In 1992, a lump in my breast was found as I was being treated for an on-the-job accident as a flight attendant for TWA. I had a mammogram, then a biopsy, then subsequently the bad news. Just after 9/11, I, along with many of my fellow furloughed employees, was suddenly without a job and without health insurance. After exhausting COBRA, I sought and was denied health insurance because of my previous bout with cancer. Many of you in the audience can relate to the feeling of abandonment by your employer, by your insurance company, and by your government. I say government because there are no laws to protect us from this type of discrimination. My experiences with our broken health system and my sister's untimely death with cervical cancer due to HPV prompted me to action. In 1997, I founded Día de la Mujer Latina, which translates to Day of the Latin American Woman, a non-profit health and wellness organization. Día de la Mujer Latina health fiestas provide culturally and linguistically specific health education and screening, follow-up care, and patient navigation to poor, underserved, and uninsured Latinas. Under our nonprofit, I was able to get health insurance, but it was pricey and limited. There was no protection for recurrence. According to the Patient Advocate Foundation, as many more Americans lose their medical insurance because of unemployment or pre-existing conditions, they are unable to access life-saving basic care and follow-up treatment. For many of our attendees, this is their only way to get a breast cancer screening and preventative care is at Día de la Mujer. PAF documented a 146% increase of cases from the previous year of patients who were negatively affected by pre-existing medical condition and did not meet the insurance underwriting criteria as a result of this. Today, together with our partners, which include local merchants and community-based organizations, hospitals, researchers and clinics, as well as countless of dedicated volunteers, Día de la Mujer Latina health fiestas have been celebrated in over 30 cities across the United States and in Puerto Rico, with a successful outreach rate of 55,000 women over the last 12 years, from all races, ethnicities. We've empowered promotoras, our community health workers, to provide health outreach and support to the many people and the families in these neighborhoods. And these folks are breaking the barriers of medical mistrust and identifying resources for care and support. With my upcoming 17 years of breast cancer survivorship and a very, very busy schedule for 2010, my resolve is to save lives of our medically uninsured and underinsured vulnerable populations, one city, one community at a time. Gracias.